1. An Epic trainer is developing a module for new clinicians. What principle of adult learning should guide the initial design of the training? A. Emphasizing theoretical knowledge over application. B. Focusing on memorization and repetition. C. Allowing learners to draw on their clinical experience. D. Avoiding learner input to maintain structure. 2. During a live Epic classroom session, a physician expresses frustration over the perceived complexity of the system. What is the best approach to address this? A. Ask the physician to write down their concerns for later review. B. Redirect the conversation and continue the lesson. C. Validate the concern and explore how the system supports workflow efficiency. D. Ignore the comment to avoid disruption. 3. A lead superuser is mentoring a peer on using Epic tools for documentation efficiency. Which method promotes adult learning best? A. Handing over a detailed manual. B. Demonstrating the tool and encouraging immediate hands-on practice. C. Lecturing on system capabilities. D. Assigning homework on Epic updates. 4. When developing a curriculum for new Epic users, what should be prioritized in alignment with adult learning theory? A. Content uniformity across roles. B. Preloaded, generic workflows. C. Customization based on learner-specific job roles. D. Heavy focus on system backend. 5. A regulatory audit revealed clinicians were not entering patient data in a standardized format. What should be the trainer's first response? A. Punish those not complying. B. Reassess training for clarity and emphasis on standards. C. Increase testing rigor. D. Ignore since data is eventually entered. 6. Which evaluation method provides the most accurate measure of skill retention in Epic training? A. A survey on training satisfaction. B. A written multiple-choice exam. C. Direct observation in a live clinical environment. D. Group discussion on theoretical functions. 7. During a post-implementation review, a department reports inconsistent use of smart phrases. What mentoring strategy is most effective? A. Require completion of an online refresher. B. Host punitive performance reviews. C. Conduct peer-led best practice sharing sessions. D. Remove smart phrase access temporarily. 8. What communication strategy best supports successful Epic upgrade rollout to a large clinical staff? A. Email the release notes and expect staff to read them. B. Hold a mandatory all-staff lecture with no questions. C. Provide short, role-specific video updates in queue and sessions. D. Allow self-study with no guidance. 9. Which scenario demonstrates regulatory compliance in Epic documentation training? A. Allowing users to skip confidentiality screens. B. Requiring training completion before access to patient charts. C. Sharing logins for quicker onboarding. D. Providing only verbal training on HIPAA protocols. 10. A nurse struggles with documenting vitals using the new flowsheet layout. What is the best mentoring action? A. Refer the nurse to the manual without further instruction. B. Observe and coach during a real patient encounter. C. Tell the nurse to figure it out through trial and error. D. Email a list of shortcuts. 11. What is the most effective way to evaluate whether a new smart form is improving documentation? A. Ask for informal feedback via email. B. Monitor usage patterns and audit documentation accuracy. C. Survey users on their satisfaction. D. Send reminders to use the smart form. 12. A clinical department is bypassing decision support alerts. What training response is most appropriate? A. Eliminate alerts altogether. B. Increase the number of alerts. C. Facilitate a review session on the clinical impact of decision support tools. D. Blame users for non-compliance. 13. What is the primary goal of using scenario-based learning in EPIC education? A. To speed up training delivery. B. To reduce the need for assessments. C. To simulate real-world decision-making. D. To entertain learners. 14. When designing a competency checklist for EPIC tasks, what should be included? A. Only technical navigation steps. B. Tasks relevant to role-specific workflows. C. Generic system tasks. D. The same checklist for all staff. 15. A staff member continues to print patient charts unnecessarily. What mentoring approach is most effective? A. Mandate additional online courses. B. Review privacy regulations and demonstrate digital access alternatives. C. Issue a warning letter. D. Ignore the behavior if outcomes are unaffected. 16. How should curriculum developers ensure fairness in EPIC system training assessments? A. Use identical tests for all users regardless of role. B. Offer adaptive testing based on learner performance. C. Focus only on basic skills. D. Test only the fastest learners. 17. An EPIC report analyst creates a dashboard, but clinical staff don't use it. What is the most likely instructional gap? A. The dashboard is not visible on the homepage. B. The training lacked role-relevant application examples. C. The staff prefer paper documentation. D. The data isn't updated frequently enough. 18. Which mentoring behavior aligns with effective adult learning principles in an EPIC setting? A. Providing feedback only at the end of training. B. Encouraging reflection and self-assessment. C. Repeating instructions without allowing questions. D. Avoiding peer-to-peer teaching. 19. What is the most appropriate metric to evaluate training effectiveness post-go-live? A. Number of hours spent in training. B. Participant feedback only. C. Reduction in user-reported errors and support tickets. D. Length of the training manual. 20. Which of the following best supports curriculum development for EPIC upgrade training? A. Reusing previous materials regardless of change scope. B. Engaging stakeholders to identify workflow impact. C. Posting system patch notes in the break room. D. Asking trainers to handle upgrades ad hoc. 21. A clinical educator wants to encourage active learning in EPIC training. What method is most effective? A. Demonstrating all tasks without participant interaction. B. Using multiple choice questions only. C. Integrating hands-on simulations with real scenarios. D. Focusing on memorizing key terms. 22. An EPIC training module has a high dropout rate. What should be the first step? A. Add more complex content. B. Evaluate learner engagement and usability. C. Require users to retake the module. D. Remove all assessments. EPIC Skills Assessment Test. The EPIC Skills Assessment Test is a comprehensive evaluation designed to measure an individual's proficiency in using the EPIC Electronic Health Record EHR system. This test assesses key competencies such as clinical documentation, navigation, order entry, reporting, and patient safety protocols across various healthcare roles. It is often administered during onboarding, training, or certification processes to ensure users can operate the system effectively and in compliance with organizational and regulatory standards. The test also evaluates users' understanding of workflow integration, data accuracy, and system optimization. High performance on the assessment demonstrates readiness to use EPIC tools efficiently, supports improved patient care, and minimizes errors in a fast-paced clinical environment. Here are the top 5 beneficial uses of the sample exam. 1. Validates user competency. The EPIC Skills Assessment Test ensures that clinical and administrative staff possess the essential EHR skills needed to perform tasks accurately, efficiently, and in compliance with healthcare regulations. 2. Improves patient safety and care quality. By confirming that users can navigate EPIC workflows correctly, the test helps reduce errors in documentation, medication orders, and clinical decision-making, ultimately enhancing patient outcomes. 3. Supports targeted training initiatives. Assessment results identify specific skill gaps, enabling educators to tailor ongoing training and mentoring efforts, which increases user confidence and system adoption. 4. Enhances workflow efficiency. By identifying proficient users in areas needing improvement, the test streamlines clinical and administrative processes, reducing downtime and improving throughput. 5. Ensures regulatory compliance. The test reinforces adherence to HIPAA and other healthcare regulations by evaluating user understanding of secure documentation, access protocols, and system policies.